Hello, everyone. We're going to be talking now about the medications that go with the musculoskeletal system, or that it can at least help the disorder or the deficiency. So we're going to start with drugs affecting calcium levels and bone mineralizations. Just a little bit about calcium physiology, just to refresh. Functions and daily requirements critical to the function of skeletal, nervous, cardiovascular, and muscular systems. Body stores more than 98% in bones. So if we have a bone disorder, we're probably going to have a calcium disorder of some sort. Total serum calcium, another number to remember, is 10 milligrams per dL of blood. Absorption occurs in the small intestine, increased by parathyroid hormone and vitamin D. They all work together, calcium with the parathyroid hormone and vitamin D. Glucocorticoids decrease absorption. So even though we need glucocorticoids, we know it increases sugar levels in the blood and it decreases absorption of calcium. And resorption by the bone. Excretion, calcitonin augments calcium elimination, regulated by vitamin D, parathyroid hormone, and calcitonin. So hypercalcemia is usually asymptomatic. Causes are a lot of times hyperparathyroidism, just too much calcium is being produced for whatever reason, and cancer. Treatment, we're going to promote urinary excretion. We need to get it out of the blood if we have too much of it. Decreased mobilization from the bone, decreased intestinal absorption, IV saline, which is just normal saline, sodium chloride. Drugs would be Lasix, again, going to push it through the kidney. Glucocorticoids, which we just looked at, diminishes the uptake of calcium. Calcitonin helps get rid of it. Biophosphonates, inorganic phosphates, and gallium nitrate will help with hypercalcemia. When we have a deficient amount of calcium, what are we going to do? We're going to take calcium. Increases neuromuscular excitability. The clinical presentation can be tetany or convulsions. And tetany is an extreme case of where the muscles are tight throughout the body. People can die from that. Causes deficiency of the parathyroid hormone, which again is going to be for calcium metabolism, vitamin D, or calcium. Treatment, calcium supplementation through usually it's calcium gluconate and vitamin D for hypocalcemia. So disorders involving calcium are all of these listed above. Rickets is a disorder caused by a lack of vitamin D, calcium, or phosphate. It can either be all three or one of the above. It leads to softening and weakening of the bones. Osteomalacia refers to softening of your bones, often caused by a vitamin D deficiency only. Soft bones are more likely to bow and fracture than harder, healthier bones. Osteomalacia is not the same as osteoporosis, which is another bone disorder that can also lead to bone fractures. Osteomalacia results from a defect in the bone building process, while osteoporosis develops due to a weakening of previously constructed bone. So big difference. Osteoporosis, as we learned in the other lecture of musculoskeletal dysfunctions, usually with age and with lack of estrogen, where osteomalacia can be at any age, and both male and female. It's results from a defect in the bone building process. So they're alike, but they're not alike. There is a difference. And then Paget's disease is people with Paget's disease. There's an abnormal breakdown of bone tissue in specific areas. This is followed by abnormal bone formation. So they're both abnormal. The new area of bone is larger but weaker. The new bone is also filled with new blood vessels. The affected bone may only be in one or two areas of the skeleton or throughout the body, so it can be very severe or not all that severe. Paget's. It more often involves bones of the arms, collarbones, leg, pelvis, spine, and skull. And then hyperparathyroidism can be just primary. Primary is usually caused by a tumor in the parathyroid. And secondary is due to another disease, which is usually chronic. So these are all diseases that are more common that cause disorders of calcium. Osteoporosis is going to be the most common disorder of calcium metabolism. We know we have a low bone mass and increased bone fragility. We've got a lot more bone resorption or removal destruction than we do have of bone being formed. Primary prevention, vitamin D, calcium, lifestyle, meaning we're going to eat foods good and a high amount of vitamin D and calcium, and by exercise that increase bone mass, increases muscle mass. Diagnosis would be a bone mineral density measurements. It's usually an x-ray, dual energy x-ray for osteoporosis. Anti-resorptive therapy, again, remember the resorption is breakdown of bone. Drugs that reduce bone breakdown, which would be estrogen, Premarin, raloxifene, Avista, biophosphonates such as Fosamax, Actonel, and Boniva. Calcitonin salmon nasal spray is just another way to get calcium in, myocalcin. Drugs that promote bone formation are teriparatides or Forteo. And that's the end of that one. Now we'll go on to the next one, which are medications in rheumatic disorders.